Hey everybody, it's Dr. Sara Gottfried of saragottfriedmd.com. We're talking about mold today. I'm here with Michael Schrantz. Hi, Michael.
Good morning.
So I wanted to talk about the symptoms of mold illness. And so maybe we should back up for a minute and just talk about this term that's used by some of the professionals who know about mold illness and biotoxin illness of SIRS.
Oh, yes.
What's SIRS?
Chronic inflammatory response syndrome. Say that 10 times fast. Basically represents about 24% of the population, as the data is suggesting. People who are having a hard time ridding their body of toxins. They are immunocompromised in that sense. There's inflammation issues going on. And it's tough for those 24%ers because they live a different lifestyle. They have other concerns that the other 76%ers supposedly don't have to deal with.
That's right. So I'm one of those 24%. I've got the mold susceptibility genes, and that's why Michael is here today to test my house and look for mold. You'll be seeing other videos on how he does that. But I wanted to talk about the symptoms so that you could have a sense of whether mold illness might be affecting you. Now, the caveat here, of course, is that these symptoms are so vague and so nonspecific that you're going to hear about them and you're going to think, oh my God, I totally have mold illness. So we want to back up and we want to have this caveat that many different problems can cause this list of symptoms. It's just a constellation that we've found with SIRS.
Yeah, certainly. There's a whole list long, and caution, user beware going on Google to become a Google expert. You have to be careful with what the symptoms are. There are symptoms that doctors use to help direct and limit things, but the list does seem kind of disconcerting in terms of how many things there are. How do you know it's mold and not heart disease? How do you know it's that, not because you pulled your back muscle yesterday from doing yard work?
Or your thyroid's slow.
There you go.
So why don't we start off with some symptoms that kind of fit with the slow thyroid also. So fatigue, weakness, brain fog.
What'd you just say? That's all I have.
Memory issues.
Yeah. There's a whole host of them. I mean, shortness of breath.
Cough.
Yeah.
Chronic sinus infections.
It's literally a Google list a mile long of things, but they are part of what the CIRS medical community are finding with these individuals when they report problems. Mm-hmm. How do you feel?
Yeah, so I'm going to go through some of the ones that fit with more hormonal problems because I know that my listeners tend to come to me. The portal is hormones. Okay. So some of those include night sweats. You can have difficulty with weight loss, like you're doing everything right and you just cannot lose the weight. That's the main reason why I called you here today.
The weight loss?
Yeah.
Yeah.
I want to lose some weight and get rid of mold.
Run more? I eat better? I mean, we know she eats
I am
better.
running more. I have smoothies every day.
Yeah, I didn't do too good at Thanksgiving, but yeah, no, it's...
Yeah. So some other symptoms, I mentioned the night sweats, also just generally problems with temperature. And there's some pain and tingling and aches and some neurological symptoms that people can have, like this ice pick pain. Have you heard of that?
Yes, I have.
This is like the international sign of the ice pick pain.
Yeah, and we get that from people, patients I've worked with directly, who they feel like when they have a hit, when they go inside of an environment that supposedly has mold. I mean, these are environments we haven't even tested yet. Ice pick is literally the way they use to describe the feelings. It's little on their nerves, just going nuts, going crazy.
Yeah.
So doesn't change the type of test I'm going to do. And a lot of times, to be frank with you, that's why we leave the medical professionals to really help sort through the symptoms. It's good to hear the information because it does provide a dialogue and a direction, a story. But at the end of the day, I'm not a doctor to diagnose your body. As a professional, we're focused on your home to see if there's a mold. There's other contaminants we look at, but mold's a big one. And so in this case, your home today, we're looking to see if there's any evidence of mold, and we're going to use different techniques and tools to try to locate it if it's there.
Good. Well, there's other symptoms that you can find. In fact, if you go to saragottfriedmd.com, I've got a list of the symptoms that are published for SIRS. So you can learn more there if you want to see the whole constellation of symptoms. We just wanted to hit some of the highlights today before we start touring my house and looking to see if I have mold.
Yeah. Scary.
Scary. So this is part of a series on mold. I hope you'll watch some of our other videos, especially as we start to tour our home and look for mold specifically. If you want to learn more, go to saragottfriedmd.com. I've got a whole series on mold, what it is, how you get exposed, how you know if you're in that 24%, and then most importantly, what to do about it.